0 new community cases, 1 new case overseas acquired and in hotel quarantine, and I'll get Dr. Peter Aitken to just give you the details around that particular case. That means we now sit at 13 active cases. We did 5,334 tests over the last 24 hours, and as you've heard, we've done 14,171 vaccinations through Queensland Health Hubs over the last 24 hours. And I want to thank everyone for continuing to come out and get vaccinated. We know when there are long weekends and public holidays, we do see a bit of a dip, but it's great to see that over 3,000 people came out at one of our tourism, theme park, surf life-saving clubs to get vaccinated over the weekend, which is wonderful that they took up those opportunities. I do want to remind people about getting tested if you have any symptoms whatsoever. That is still critically important that we have people coming out and getting tested. And I also remind people about wearing masks. Those rules are still in place across many of our LGAs in southeast Queensland, including on the Gold Coast and Sunshine Coast. And we ask people to continue to comply with those rules. Today is the first day that our mandatory vaccinations for our Queensland health workers come into effect. I can advise that the most recent data we've got is that we have over 92% have already come forward acknowledging they've been vaccinated, although our cross-matching of data with the Australian Immunisation Register has that closer to 95%. For the ones who are not vaccinated, we have a number of those who, of course, are simply on normal long leave, whether it's maternity leave or long service leave, but we have a number of staff who will now go through a show cause process, and we will put in place measures to manage any workforce shortages that might occur. We expected this. I have every confidence that these numbers will continue to grow each day, just as we saw when we mandated vaccinations with our aged care workers. We are now at 100% of all of our aged care workers in our public settings having had their first dose and 96.3% second dose. So I'm very confident that we will end up very, very high rates of vaccinations. Of course, across the occupations in our hospital and health services, the largest cohort are those in managerial and administrative streams. So our clinical side have taken up the vaccination rate at a high rate, and we will work through these issues. But this is about keeping our staff safe and our patients and our visitors safe, and making sure we have the staff so that when we do start getting those cases that we will get, that we have the staff who are vaccinated and can manage any of those cases as they come into our hospital system. I'll now ask Dr. Aitken to just tell you a bit more about that one overseas case. Thank you.
Thank you, Minister. And as said, one new case today, and that's an overseas traveller. They've arrived, they're in hotel quarantine. They have come from the Ukraine via Doha, but they've tested positive in hotel quarantine, not in the community, which is a positive. The normal process of tracing that person's movement, and they are regarded as infectious on the flight, will occur, but they haven't been infectious in the community, and that's the most important message. I'd just like to add to that, to echo the Minister's words, if you do have symptoms, we just encourage people to continue to come forward and get tested. And also, if you haven't had the opportunity to get vaccinated yet, come forward and get vaccinated. It's not too late. We're still very keen to put needles into people's arms and protect the community and each individual as part of that. A really positive part was of the 3,399 that the Deputy Premier mentioned. Over 80% of those people were first doses, and that's brilliant because it also means that those first doses get us up towards 80% and get us up towards 90%. So thank you.
I'll just comment on our operational activities at the moment and a reminder to all of our community that we remain unchanged. So our current restrictions, our current state border postures remain unchanged and will not before the 17th of November, unless of course we see the vaccination rate achieved ahead of time, and then that will be a matter for government. So yesterday we still saw 8,000 vehicles checked at our road borders, and still people trying to come across without the proper authorisation. So 6 on-the-spot fines, $20,000 worth of fines for people trying to come across our borders without the correct border passes. So please, for those people coming into our state, you still need to understand what the requirements are coming into Queensland and abide by them. There will be sufficient notice and detail to explain what the new system will look like as we move through the changes at 70, 80 and then ultimately at 90%. That work is ongoing. Obviously there are many stakeholders across the industry, government, the community that we have to work with to make sure that we have a system in place that works for everyone. The airlines, as they start to escalate with passengers coming in, are just an example of that. So that work is ongoing, and we're very confident that as we hit those targets that we will be able to operationalise that in line with what the government has asked us to do, which is to maintain borders up until 90% so that we can keep our community safe as we go forward. I should also mention that our investigation into the man referred to as the Uber driver, Mr Rahman, has now concluded. We have interviewed Mr Rahman and he has been issued with a $4,135 on-the-spot fine for a border breach, which brings to conclusion our activities in relation to that person. I understand he still remains in hospital and unable to comment on when he may be released. I'm just going to finish off by saying, as we've already been saying lately, we're doing everything we can to make sure we keep the community safe by making sure that the Chief Health Officer's directions are observed. We've had spectacular success in Queensland for reducing the number of people that have been infected and died. We need to be able to move forward. We need the community to get vaccinated. Our police officers have stood up and done that. 99.5% of our organisation is now compliant and vaccinated. We really need the community to get on board with that as well. So please get vaccinated. Thank you.
Any questions?
We're not far off that November date, November 17, 70% mark. When's the government going to release the home quarantine details for those people who might be coming in on 50 days back?
Thank you for that. So yes, it's the 19th of November is that first threshold and 17th of December for the 80% threshold. And we're certainly on track and looking great with the 70%. Of course, we're already over first dose, 77%. And of course, second dose is 63.87. We are finalising that criteria currently. I expect it to be released very shortly so that everyone knows ahead of time what that criteria is, and that I can clarify that people will be able to transit through Brisbane, so it doesn't need to be a direct flight. If you're going to Cairns or Townsville, for example, from Sydney or Melbourne, you will be able to transit through Brisbane, which we've allowed this previously, to then travel and home quarantine. But people should assume and expect that the rules applying to those people who home quarantine now as part of our 1,000 trial out of Brisbane will be very similar to other airports and the criteria that will be needed. Most importantly, fully vaccinated and be 2 weeks since you got your second dose, and of course that negative test. Those are the two most critical elements. Anyone wanting to return, either at the 70% mark or by road at the 80% mark, need to make sure they're getting vaccinated and get that double dose now so that they can meet that criteria.
Do you expect it to be in a house or will they be able to quarantine in a unit?
So we're working through that. Certainly it will continue standalone residences, some detached arrangements such as townhouses where there is direct access and they're not having to go through corridors and common areas to access their homes. It is expected will continue that arrangement under the 70% rule.
What's the current frame on reaching 90% and returning international travel?
Well, ultimately that's up to Queenslanders. We want to hit that 90% mark as quickly as possible. If all of the remaining Queenslanders who are unvaccinated were to come out in the next week, we would hit our 90% mark literally around 4 weeks after that for double doses. So it's in the hands of Queenslanders. The vaccine's there, it's available, not just at all the Queensland health hubs and pop-up clinics that we've got, but also community pharmacies and GPs. So there is no reason for people to delay getting vaccinated. Large proportion of those people live in southeast Queensland. They have easy access to a vaccination. And if people want to get to that 90% mark, in 4 weeks, then they can come out today and get fully vaccinated.
What's the state's rationale behind opting to wait until 90% of Queenslanders are fully vaccinated?
Because even at the 80% mark, that still means 20% of our population, 16 plus, could end up getting this virus and ending up seriously ill. Now, that's a lot of people who could end up in our hospital system and in ICU, and a huge burden on the hospital system. And we have seen countries like Singapore, who opened up at the 80% double dose mark, and it took about 4 to 5 weeks before they reversed those restrictions and started requiring people to work from home and students to learn from home, because they got mass outbreaks at the 80% mark. So there is many examples where the 80% mark is not enough to try to reduce the pressure on the health system and impacts on businesses. If businesses have large numbers of staff who are unvaccinated, if they have an outbreak, they're not going to have the workforce to operate. So it's really important we get to that 90% mark.
COVID is rampant interstate in New South Wales and Victoria. What's the science between allowing people from those states in and not overseas?
Well, look, we've made it very clear. At the 80% mark, you'll be able to travel into Queensland if you're fully vaccinated and have a negative test by road or by air. We've said overseas they can home quarantine, which is reasonable, but we do need to make sure that we are managing our way. The other states, Victoria and New South Wales, are in a very, very different position to the other states and territories that haven't had major outbreaks and aren't living with major outbreaks now. It's in effect a bit simpler when you've got 1,500 plus cases every day to say, well, it's okay for people from overseas to come in with the virus because we've already got this virus spreading throughout our community. When you are a state that doesn't have the virus spreading to the community, we have 13 active cases. That's all in Queensland.
But that's the point, isn't it? What's the science in allowing people from those COVID-ravaged states, as you will, to come into Queensland, but not people from overseas?
Well, they have
even
to be.
if they're from a country where
Yeah,
there might be a
they
lot of
have to be
COVID.
fully vaccinated. They have to have their negative test. It's still a risk. That's why we've been saying to people that on the 17th of December, or whenever we hit the 80% double dose, Queenslanders should brace for this virus to come in.
It is, but I'm just asking, what's the science to differentiate between COVID-ravaged states and COVID-ravaged countries?
Well, because there could be other variants that are brought in. You have to look at the different vaccines and the efficacy of those. There's a whole lot of reasons. We go off the health advice. This is the health advice that we've received, and we support that health advice. We think it's reasonable and sensible. At the 80% mark, people will be able to fly in from overseas and they'll be able to home quarantine.
Spoken about percentage of Queensland health workers who are vaccinated. How many Queensland health workers haven't been able to go to work today because they aren't vaccinated?
Well, we've got just over 7,000 that have not come forward and confirmed their vaccination. I need to say there's around 3,000 of those people who are already on normal long leave and maternity leave. So there's around 4,000 that are unvaccinated who otherwise should be at work and who will be given show cause. Now, some people have taken leave of that. Others will be given a show cause today and suspended on full pay while we work through that process. But that's around the 3,000 mark that might be given a show cause today. Now, some of those people may come forward and get vaccinated very quickly after that, and we saw that with aged care as well. I expect those numbers will start reducing very quickly. But ultimately, this is a decision for the health worker. Whether you work in the public sector or the private sector in Queensland, whether you work in Queensland or Victoria or New South Wales or other jurisdictions, you are required to be vaccinated. So if you want to work in a health workforce anywhere in this country, you are going to find the same requirements for them. So it's not unreasonable. Queensland's certainly not going it alone in this space, but it is about protecting our staff. We have a duty of care to do that, and the patients and visitors.
When it's out of the workplace, that's a large number. How will services cope?
Well, this
Are there
is.
any particular areas that you're especially worried about?
Remember, we've got across our hospital and health services over 108,000 workers. The large majority of our clinicians and nurses are vaccinated. The largest group, as I said, unvaccinated, managerial and administrative. But we've still got some nursing staff, but again, a number of those are on maternity leave and long service leave. So there will be some disruptions, but we are managing those disruptions. There are a number of hospital and health services that there will be no disruptions at all, but we have been planning for this. And this is what the TGA said, that there will be unexpected disruptions, but those disruptions are far less in having 3,000 to 4,000 staff not in the workplace, is far less than if we had unvaccinated workers of the 108,000 who would be looking after patients who could get the virus themselves.
Has Queensland considered cutting down the home quarantine time period from 14 days to 7 days?
What we have said is the AHPPC will be looking at this. I understand they were considering it again last week. We will go on the advice of AHPPC. There was a trial that was occurring in South Australia. We'll wait to see what the findings of that trial are. But at this stage, I'm not aware AHPPC have changed their advice on the 14 days. We're happy to reconsider the time people have to quarantine, but it should be based on that health advice.
Just to clarify, because there has been some confusion, an overseas traveller could come into, say, New South Wales, not quarantine there, spend 14 days there, then cross the border without having to quarantine in Queensland.
Yes, but remembering those people will have to be fully vaccinated and have to have a negative test. So they've not only had to have a negative test when they've flown into the country, and just remember, at the moment, people are supposed to be having a negative test when they get on planes overseas. The number of people turning up in Queensland from overseas, and we've got another one today, who are testing positive on day 0. The first day they walk into hotel quarantine, they're coming up positive, or day 1. So we're getting quite a few that are showing up positive very quickly when they go into hotel quarantine. So these people still have to come into Queensland and show that they've been vaccinated and that they are negative with that test as well. So, I mean, the 14 days.
Sorry, when we've opened borders and there's a lot of COVID everywhere, but we do also have those high levels of vaccination, what will the rules be around the 14-day having to stay home if you come into contact with a close contact? I know Jeanette Young has said if you have COVID, or you and your household will have to isolate for 14 days. What about a teacher who has a COVID-positive child, or a GP with a COVID-positive person, or someone who's been in a bottle shop with a COVID-positive person?
So all of the advice, the Doherty modelling, as well as QIMR's modelling that we have received, says that all of these lifting of restrictions have to operate on the basis that we are still testing and we are still making sure that we are tracing and we're isolating and quarantining. So we have not been given any advice on the modelling as to when that should cease. What they've said is you can still manage this virus amongst the community if people are still coming out and getting tested. We can still trace where they've been and we can tell people they're close contacts and we're isolating and quarantining. So we expect, certainly at the 70 and 80% mark, that people will still be quarantining for 14 days based on AHPPC advice, unless that advice changes. But of course, we will continue to take the advice. If things change, if the advice we're getting from the health professionals are that you can quarantine for shorter periods of time, or you don't need to put as many people into quarantine if they're close contacts, then we'll take that advice. But at this stage, it is still testing, tracing, isolating and quarantining.
So if we have 1,000 cases a day, we can expect a lot of disruption to our lives if we do come into contact with someone who has...
If people are unvaccinated. So we will work through the advice and what the restrictions should be. We've seen, for example, some jurisdictions have said that their quarantine and any lockdowns that they have may differ for people who are vaccinated. So people who are fully vaccinated may still be able to go to work if they're a close contact, where if you're unvaccinated, you have to quarantine. So we'll work through all of those things. Of course, if you're positive, and giving the examples you did, if a child is sick with COVID and quarantining at home and their parent is a teacher or a doctor, it's up to the parents to make the decision who quarantines with that child, of course. But if they've been close contacts, we'll take that advice at the time. But it may very well be different if you're fully vaccinated compared to unvaccinated.
The government had a deadline yesterday for people to come forward and get their first dose to be protected as part of the December. Now that that's kind of come and gone and we're still below the 80% mark, what more is the government planning to do?
So let's be clear on the countdown that the Premier has been talking about and the government's been talking about. That countdown is so that you can have the best protection possible when the borders open on the 17th of December. As in, you've had 2 doses of vaccine and it's been 2 weeks since you've had your second dose. We know that gives you the best protection possible. What that means going forward is if you are not vaccinated fully yet or you haven't had your first dose yet, it's more important than ever that you come out now, because it's going to take longer for you to have that full protection. So you still won't have that full protection when we open up on the 17th of December. But you can have the best protection that you can by getting your first dose today and making sure you're getting your second dose when it's due. So that's why we're giving that countdown to say if you want to be fully protected by the time the borders open, you need to have already had your first dose. But if you haven't had your first dose, you still can have partial protection. And it is still critical, more critical than ever, that you come out and get vaccinated as quickly as possible.
You sure about that?
Sorry?
Are you sure about those maths? Because if you got vaccinated today on the 1st of November, 3 weeks, your second dose will be in November 22. 2 weeks after that's December 6, which is still well in advance of December 17.
So the countdown was for your first dose, depending on whether you've had Pfizer or Moderna, it's 3 to 4 weeks before you can have your second dose, and then it's another 2 weeks after that. So there's a 6-week period there. It's the 1st November now, so it's roughly that period that to get your full protection.
If you got shot today or tomorrow, you'd still be fully protected under those guidelines by December.
Look, I'm happy to go off and do the sums. The message is pretty simple. It's as simple as this. Go get vaccinated now. The borders are opening. The virus will come in. Get vaccinated now. Let's not get preoccupied with those. Yeah, as I say, you want to get fully protected, and the only way to get fully protected is to come out and get vaccinated today. It's that simple.
Minister, with the roadmap, so from my understanding from your original answer, 80% for to open the interstate borders and 90% for overseas kind of staggers the infections and helps the hospitals, right?
Yeah.
So has that health advice though been framed against the realities of the logistics of a holiday period where New South Wales and Victoria are just like, let it go, and all of these people are trying to get in, and the police reinforcements that are required up to 90%.
Sure, we will work with the Queensland Police Service about how to operationalise those road borders opening up. But remember, we want to make sure, and all Queenslanders want to make sure, that as people start flooding across the border by road in their cars and caravans to holiday and see loved ones and relocate and come back home, we still need to make sure they are fully vaccinated, and we need to make sure they've had a negative test. So there still has to be a mechanism to ensure that only those people who are eligible are coming into the state. But we will work with the police how to operationalise that to make sure that we have the least disruption, but that we are still keeping people safe, and we are making sure that people who are coming into this state are complying with the restrictions that were put in place.
One of the deputy chief health officers, I think, over the weekend said that the state is looking at some more modelling to determine if broader international travel could come back before 90%. Was this coming through the Doherty Institute National Cabinet or QIMR?
Well, we'll look at all of the modelling. It would be great for there to have been a national approach to this, but unfortunately some jurisdictions have gone off and announced their own plans. We have released our plan to reunite families. We believe it's a sensible plan. It is based on both the Doherty modelling but also the most recent modelling we've had, which looks at Queensland and what's happening in Queensland from the QIMR Institute. And of course, we'll continue to take the advice on that. And I'm sure there'll be further discussions at a national cabinet level.
And on suppose national issues as well, the rapid antigen testing opening up becoming available to buy from today. How has the state made any more progress on how that's going to be implemented?
Well, look, there is those tests. What I've said before, and the Chief Health Officer has said before about these tests, is the PCR tests we do now are far more accurate. That if someone was to get one of these rapid antigen tests and it comes up positive, they will still have to have that test verified then by a PCR. So what that means is there'll be a delay in getting their result. We have a really good testing system in this state, a highly efficient, accurate testing system in this state that is free. So why wouldn't you come out and get the free test if you have symptoms, as opposed to having to purchase a test that would require you to get a second test to verify it anyway. Now, things will evolve, and these tests may be used for certain circumstances, and they may be very helpful as we move forward and start living with this virus in our community. But right now, if you have symptoms, we want you to come out and get one of our free PCR tests, as opposed to purchasing one of these to test whether you are positive or not. Because if you have symptoms, there is no benefit in delaying that. It is really critical you come out and get the most accurate test so we can find out whether you have COVID or not.
Just on that, the roadmap mentions that the test that people need to show to come into Queensland and the borders reopen, it just says PGA approved. So is that both can be a PCR test or a rapid antigen if needed?
It can be either as things evolve, and we'll take the advice of the health officials as to what we should be using as we open up more.
No. In a word, Jeanette's done an amazing job under difficult circumstances for a long period of time, and those decisions have been based on the information provided by experts through the HPPC, the CDNA, Community Diseases Network of Australia, and I think the advice that she's provided has been exceptional, and I'll continue to hold by the direction that she's established. Sorry, I missed that. Business as usual, yep. And business as usual as fast as we can, towards 80%.
Dr. Akin, if there was new variants of COVID,
yep,
and overseas, you would expect to see them pretty quickly in southern states, would you not?
Not
international travel over that?
Look, the Commonwealth is monitoring that, and we do get information through the HPPC and other groups, but it's the Northern Hemisphere international winter which will be the cause of concern, and they're not through their winter yet, so we'll continue to watch that. As mentioned earlier, it's one of the reasons we are still more concerned about international arrivals.
Dr. Akin, can you have a watching brief on what's happening in the PNG, considering COVID is so rampant there that surely the fears of a variant could come up north of us?
Sorry, if you're asking about particular countries, or?
Yeah, sorry, Papua New Guinea.
Papua New Guinea, sorry, I missed that. Yes, we are continuing to watch, and we've had Australian teams over there helping with the advice for the health system in PNG at the moment, and Queensland has had 3 members of that team over there currently, and the Commonwealth meets with our PNG counterparts, and we meet with the Commonwealth and watching it very closely.
Does that situation concern you, considering how close PNG is to the north of Queensland?
Absolutely, it's concerned us from the word go, and we meet with Torres and Cape HHS, Border Force, DFAT, the Commonwealth and our PNG counterparts to watch that situation. And it's one of the reasons the Australian Government and Queensland Health have provided assistance to PNG.
Can I ask the health minister quickly about Twitter?
One last question here.
On the complaint that you lodged with Twitter regarding Gareth Way, do you accept Twitter's decision, and were you trying to silence the opposition as Mr. Blay has suggested?
Of course I'd accept the ruling of Twitter. That's why I wrote to them. I didn't play cheap politics on social media. I wrote because I was concerned that there was misinformation, misleading information out there from a particular member of the opposition, and I wanted Twitter's ruling on that. How you can say that I'm trying to silence the entire opposition when I wrote in relation to one individual, I think that's a little bit of a reach from the opposition, but of course I accept the ruling that they believe that it was an allegation as opposed to misinformation. and yeah, it is what it is. The decision's been made. Thank you.